Welcome to the movie.
Hi everyone, I'm Sarah with BJC School Outreach and Youth Development. Welcome to Sexually Transmitted Infections. The objectives for today's lesson are: learn ways to take care of your own body, recognize myths about sexually transmitted infections, and empower people to be able to discuss STIs with a partner or healthcare provider. STIs affect more than 20 million people in the United States each year. Half of these new cases occur in people under the age of 25. 1 in 2 sexually active people contract an STI by the age of 25. The reason that we're doing this presentation is so you can keep yourself and the people you care about protected from sexually transmitted infections, and that takes good information. There are 2 basic types of sexually transmitted infections. Some are bacterial and others are viral. It's important to know the difference, so let's cover bacterial infections first. Bacterial STIs can be treated and cured with antibiotics or other medicines. These include chlamydia, trichomoniasis, gonorrhea, syphilis, and pubic lice, also known as crabs. Let's talk about chlamydia. Chlamydia is spread through vaginal, anal, or oral sex, and about 1 in 20 sexually active people under the age of 25 currently have chlamydia, so it's very common. In fact, it's the most common bacterial STI. Chlamydia may have no symptoms, or abnormal discharge from the vagina or penis, burning sensation when urinating, sore throat, abdominal pain, low back pain, nausea, and fever, or bleeding between menstrual periods not associated with birth control. Abnormal discharge is a symptom of several STIs. So here's a question. What is abnormal discharge anyway? Normal discharge fluids are cervical fluid, which happens during ovulation, menstruation, which happens during a period, and semen, which happens during ejaculation. In the next video, Dr. Holly Merritt will describe what normal cervical fluid looks like. This information also applies to semen.
Is it normal to have discharge? Yes. Hello. Discharge is normal, and everybody has it. It is a very, very common question that I get all the time. You could be having discharge for a lot of reasons. You may notice especially a lot of discharge around the time that you ovulate. That's your body preparing for pregnancy, and that's normal. You may notice that it turns white later in the month. That's also normal. Vaginal discharge comes in all textures and shapes and sizes and colors. It can be normal to have clear discharge, to have it be white, to have it be watery, to have it seem thick, to have it be creamy. All that's normal. You should be concerned about your discharge if it's causing you discomfort, if it's causing you pain, if it's causing you to feel itchy, or if you notice a change in smell. Or if it looks like it could be pus. That is really important. If it looks like pus, go see your doctor. Another common cause of having a change in your discharge is something called bacterial vaginosis, or BV, is how we also talk about it. This is not a sexually transmitted infection. It's not really an infection at all. It's just a change in the balance of the bacteria that are living inside of there. The problem for you is that the only way to treat it is with antibiotics, and so you gotta go to the doctor. You can't treat it on your own. It's not gonna get better with douching. It's only gonna get worse. Come and see us.
The next infection, trichomoniasis, is actually a parasite, but it's still treated and cured with medicine. It's typically contracted through vaginal sex and only rarely through anal or oral sex. It's also very common. Over 1 million new cases per year show up in the US. About 70% of people with trichomoniasis don't show any symptoms at all. For those that do, symptoms include abnormal discharge from the vagina or penis, which could be clear, white, yellow, or green, a burning sensation when urinating or ejaculating, or discomfort during sex. Here is a picture from the Centers for Disease Control and Prevention showing what trichomoniasis looks like underneath a microscope. Gonorrhea is an infection passed through contact with the penis, vagina, mouth, or anus, not necessarily through sex. It's also passed from mother to child during labor, which is why all mothers are tested for gonorrhea. Unfortunately, the rates for gonorrhea are higher in young people, with 600,000 new cases per year. Gonorrhea may have no symptoms. It may also have a white, yellow, or green discharge from the penis or vagina, burning sensation when urinating, painful or swollen testicles, bleeding between menstrual periods not associated with birth control, or painful bowel movements. Syphilis is passed through any direct contact with a syphilis sore, which could happen through vaginal, anal, or oral sex. It's also passed from mother to child during pregnancy, so pregnant women are tested for syphilis, and it affects about 55,000 new people each year. Syphilis symptoms have 3 stages. In the primary stage, the person has a single sore, which isn't painful but is contagious. If left untreated, syphilis will go away but may return in the secondary stage, which feels a lot like the flu. This stage may include rash, fever, swollen lymph nodes, sore throat, patchy hair loss, headaches, weight loss, muscle aches, and fatigue. If untreated, syphilis may move into the tertiary stage, which causes damage to internal organs, joints, the brain, and the eyes. You are about to see a picture of a syphilis sore on the tongue. It looks a bit like the skin underneath a scab after it's been removed. Remember, this isn't painful. It also tells you what kind of sexual activity the person was involved in. If you guessed oral sex, you're right. Next, you're going to see a common symptom of secondary syphilis. It's a rash that appears typically on the palms of the hands or the soles of the feet. Now, unlike the picture that you just saw, this won't indicate where a person got the STI. It just tells a doctor that they have syphilis. The next infection is really more of an infestation called pubic lice or crabs. Crabs are spread through sexual contact, but can also be spread through contact with clothing, linens, or towels used by an infected person. It's estimated about 3 million people a year get pubic lice. Symptoms of pubic lice include visible lice eggs or crawling lice in the genital area or itching in the genital area. Pubic lice is not treated with antibiotics. It's treated by washing linens in hot water and a hot dryer cycle, using shampoos or other ointments, or by removing the hair in the area. You are about to see a magnified picture of pubic lice. Now you can see why they're called crabs, right? Remember, this is a different type of lice than head lice. This type only lives in the genital area. Great job. That does it for all of the bacterial STIs. We're going to move on to the viral ones in a minute, but for now, just take a break, rest your brain, take a stretch. That was a lot of information. We'll move on in just a sec. Now let's move on to sexually transmitted infections caused by viruses. These STIs can be controlled but not cured. What do you notice about the viral STIs? They all start with the letter H. This is an easy way to remember which sexually transmitted infections are viral. The first viral infection we'll discuss is human papillomavirus, or HPV. People get HPV through vaginal, anal, or oral sex, or skin-to-skin contact with an infected partner. There are over 150 different strains of HPV, and many of them don't cause any harm at all. It's very common to get HPV. 1 in 4 sexually active people currently has HPV, and the CDC says that nearly everyone at some point in their lives will have some form of HPV. This makes HPV not only the most common viral infection, but the most common sexually transmitted infection overall. We should talk about that last point. One of the symptoms of HPV is having no symptoms at all. The reason for this is because about 90% of those strains of HPV wouldn't cause someone to be sick. Their body would naturally fight off HPV within about 2 years. This is especially true for people with healthy immune systems. However, other strains are known to cause genital warts or precancerous changes in the cervix, vulva, vagina, anus, penis, throat, tongue, or tonsils. An HPV infection and the precancerous changes it causes are a primary cause of cancer in many of those body parts. For this reason, there's a vaccine available at age 11 or 12 and is recommended before the age of 26 to protect users from the harmful effects of HPV. Here's a picture of genital warts on different skin tones. A wart would be different from an ingrown hair or a pimple in that a wart is not sensitive to the touch and it also wouldn't disappear after a few weeks. The next STI is herpes. There are 2 basic forms of a herpes simplex virus. The first are fever blisters on the mouth, which aren't necessarily related to any sexual activity. And then there's the second kind, which is herpes on the genitals, which is sexually transmitted. We'll talk about both of these for a reason. Herpes is spread through vaginal, oral, or anal sex, or skin-to-skin contact with a sore. In fact, it is believed that 40% of current genital herpes cases were caused because someone had fever blisters on the mouth and engaged in oral sex with someone else, giving them herpes on the genitals. There are about 776 new cases per year of HSV-2, genital herpes, and more cases of HSV-1, blisters on the mouth. The symptoms of herpes include no symptoms at all, or sores 2 weeks after the virus is transmitted. It may also come with flu-like symptoms like fever or swollen glands. The appearance of herpes sores may happen one time. It may also happen several times in a person's life once they've contracted herpes. There are medicines available that can be prescribed by a doctor to lessen the symptoms of herpes and make the outbreaks less frequent. You are about to see a picture of HSV-1 or blisters on the mouth. Remember, these aren't usually sexually transmitted, but they can transmit genital herpes to someone during oral sex. Now you're about to see a picture of HSV-2 or genital herpes. These clusters of blisters on the skin would appear and then eventually disappear and fade over a course of 2 or 3 weeks, taking up to 4 weeks to heal completely. The next infection is human immunodeficiency virus, or HIV, the virus that causes AIDS. HIV breaks down the immune system, making it easier for the person to get sick from other diseases and germs. It's passed typically through vaginal or anal sex, with oral sex being very rare, or through sharing intravenous needles. About 41,000 new cases of HIV appear in the U.S. each year. There are 2 stages of HIV. In the first stage, which is the acute stage, 2 to 4 weeks after infection, a person may experience no symptoms. They might also have flu-like symptoms like fever, chills, rash, night sweats, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. The person feels like they have essentially a really bad version of the flu. They're also highly infectious in this stage. The second stage is the latent stage, where the person experiences no symptoms or only mild illnesses. The reason for this is because the person is typically on medication. On medication, the latent stage is believed to last 10 or more years. In fact, right now, the average latent stage for a person with HIV who's on medications can last up to the age of 64. So those medications cause a lower level of infectiousness to the person and also to others. In fact, if a person consistently takes medicine, their viral load or the HIV virus in their body may become so low that they can no longer pass the infection on to their partner. Once HIV has progressed to stage 3, Stage 3 of HIV is called Acquired Immune Deficiency Syndrome, also known as AIDS. At this stage, HIV has heavily impaired the immune system, and the body is no longer able to fight off infections like the common cold or the flu. So the person may continue to get sick and not be able to heal. They are also once again infectious at this stage. It's important to remember that AIDS is another name for the third stage of the HIV infection. Or in other words, AIDS is developed only through an HIV infection. It can't be directly sexually transmitted. Once someone develops AIDS, their symptoms include chills, fever, sweats, swollen lymph nodes, weakness, and weight loss, just like the early stages of HIV. But now they also may have symptoms of other acquired illnesses that their body is trying to fight. Here is a list of methods that have been believed to transmit HIV. Some of them are true, and some of them are not. Can you guess which ones are true? I'll give you a minute. These methods don't transmit HIV. You can't get HIV through a bee sting or a mosquito bite. You can't get it from someone sneezing on you or sharing a drinking glass with them. And you also cannot get it by donating blood. These methods really do transmit HIV. A mother could transmit HIV through breast milk. It can also be transmitted through unprotected sex, through semen or vaginal secretions, and it can be transmitted through blood, which is why sharing needles might be a cause, and also why donated blood is always tested for HIV before being given to a recipient. The last infection is hepatitis B, which ranges from acute illness lasting a few weeks to chronic illness that can lead to liver disease or liver cancer. People get hepatitis B through vaginal or anal sex, by sharing needles, or passed by mother to child during childbirth, which is why pregnant mothers are also tested for hepatitis B. It's estimated that there are about 19,000 new cases of Hep B in the US each year. People with hepatitis B may experience mild symptoms or no symptoms at all, flu-like feelings that don't go away, tiredness, jaundice, which is yellowing of the skin, dark urine or light-colored bowel movements. There is a vaccination series available for hepatitis B that most people get at birth and then again at 6 months. You can also get it up until the age of 18, which is why hepatitis is lower in young people. All right, nicely done. One more quick stretch and we'll move on to the end. You are almost finished with this lesson. Now that you've learned about sexually transmitted infections, let's talk about prevention. There are two main ways that people prevent STIs. The most effective way is abstinence. If a person abstains from sexual contact or sexual intercourse, their rates of STIs will be dramatically lower. Also, high-risk behaviors like sharing needles or having sexual contact with a person that I don't know very well or haven't really communicated with are other ways to abstain. The next strategy is risk reduction, which includes planning ahead. If you know what to expect before you have a sexual encounter, it will keep you safer than waiting until the moment is happening. The next is communication. Frankly, if you are not mature enough or if you don't trust your partner enough to talk about sex and protection, you are not ready to have sex with that person. So being able to communicate maturely and responsibly is also risk reduction. The third is protection. Using protection during sexual contact greatly reduces the risk of a sexually transmitted infection. But as you know from those slides, there are a couple of STIs that are transmitted through sores like syphilis or herpes. And so planning ahead and communicating are also really important for STIs that can be spread through contact with a sore. And finally, having a relationship with a provider who can provide STI testing and also keep me healthy is a great idea. There are still about 10 million young people each year who learn that they have a sexually transmitted infection. And so with that in mind, let's talk about body image and STIs. First of all, respect for your body doesn't change if you believe that you have a sexually transmitted infection. You have value and you need to take care of yourself. And that includes seeking appropriate and consistent medical care for early detection of sexually transmitted infections and also for treatment, because the sooner someone gets treatment for a potential sexually transmitted infection, the easier it is to treat or cure that STI. And finally, if someone does get an STI, take good care of yourself and your relationships, because those are the things that you can control. And these carry over well past things like sexually transmitted infections into life. Taking care of yourself and your relationships is always a good idea. So take care.